Good afternoon. Today we'll be dealing with the subject of radiotherapy and gynecology. Not a very important topic from the examination point of view, but sometimes very short questions like 3-number questions may come from this topic. So radiotherapy plays a major role in the treatment of patients, mainly of gynecological malignancies. As you all know, in the last few years of 19th century, the X-rays and the radioactivity was discovered. The names of Roentgen and Curie's are popular in this regard. And the discovery of radium and followed by artificial nuclides had an important role in this. And later on, biological effects of radiation were also discovered, which were used for various purposes in medicine, especially in the treatment of malignancies. So, as already has been told, that it's an important role in the management of gynecological malignancy, and its specific curative role has been established in the management of cervical cancer, which is the most commonly seen gynecological cancer. It can also be used for localized endometrial cancer when surgery is not possible. And radiotherapy also improves the prognosis if used as adjuvant therapy. That means some therapy has been used earlier. Later on, radiotherapy can be used. And the scope of radiation therapy has been enhanced also in the management of cancers of vulva and vagina. In selected cases of cancer of the ovary, postoperative adjuvant radiotherapy may be beneficial in controlling the disease. So, physical principles of radiation therapy we should know before proceeding to the subject proper. Radiation physics deals with the measurement of energy that is transferred from the radiation source to the target tissue which is being irradiated. So, that measurement of energy has to be done. So, therapeutic activity of radiation is mainly related to the process of ionization. So the ionized particles are being used in the radiotherapy. So ionizing radiation is usually of two major types. One is photons, which are X-rays and gamma rays. This is mainly used in the cancer treatment. And then there is a particle radiation in form of electrons, protons, neutrons, carbon ions, alpha particles, and beta particles. So this thing, X-rays are like electromagnetic radiation, and this source of energy has no mass and no electric charge. And the second portion of the photon that comes from the production of gamma rays, which is similar to X-rays, and which result from the decay of the radioactive isotopes. So some types of ionizing radiation have more energy than others. The higher the energy, the more deeply the radiation can penetrate the tissue. And the way certain type of radiation behaves is important in planning the type of the radiation treatment. So photons, as we discussed earlier, they act by dislodging orbital electrons of the tissues through which they pass. This collision, that is transmission of the photons through the tissues, produces a fast electron, which is known as a Compton effect, which then ionizes the molecules along its path, producing secondary electrons. So this thing, and along with the production of secondary electrons, free hydroxyl radicals are also produced. So about 80% of the cell contains water. So cellular radiation damage is mediated by the ionizing radiation of water and production of free radicals, that is hydrogen and hydroxide. So the process of this Compton effect continues until the photons loses all its energy. So effects of radiation on the tissues are of two main types. One is a loss of mature functional cells by apoptosis, that is a programmed cell death. It usually occurs within 24 hours of radiation, and there is also loss of cellular reproductive capacity. So effects of radiation depends on the 4 hours of radiology. Like we had studied of 3 hours of in the school, like reading, writing, or arithmetic. So in radiation there are 4 hours of radiobiology. They include repair of DNA damage, repopulation, redistribution, and reoxygenation of hypoxic tumor cells. And radiosensitivity of any tissue is directly proportional to the degree of the mitotic activity and inversely proportional to the degree of differentiation. So degree of mitotic activity means the more rapidly the cell multiplies, the more radiosensitive it is, and the more anaplastic it is, the more radiosensitive it is. So germ cell tumors such as seminomas and dysgerminomas are highly radiosensitive, and squamous cell carcinoma is moderately radiosensitive, whereas osteogenic sarcoma, which is a very high degree of differentiation it has got, it is a radio resistant. So there is a two modes of action by which the radiation acts. One is a direct action and another is indirect action. Direct action means radiation is absorbed and this causes direct damage to the DNA. And so predominant mechanism of action is of the particulate radiation, that is neutrons. And indirect action is here radiation interacts with other substances, that is water in the cell, to produce free radical, that is hydroxyl, which in turn damages the DNA. So photons usually they produce an indirect